Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. This episode features perspectives on aging patients with HIV living in resource-limited settings. During this podcast, Dorothy Onyango, founder of the Women Fighting AIDS in Kenya, shares some of her struggles of aging with HIV in her home country of Kenya. She also offers some possible solutions. For more information about Dorothy and for a link to the full online educational program, please visit the link in the show notes for this episode. Now let's get started and hear what Dorothy has to say about this topic.
Morning, my name is Dorothy Onyango. I am the founder member of Women Fighting AIDS in Kenya, which was founded in 1994. This was as a result of my HIV diagnosis. And I realized that there is something that I need to do. This came about especially when I attended a conference in Amsterdam in 1992 of HIV positive women, 54 of us. We were there and we just shared how best we can work together when we go back to our homes where we did not already have support groups for women living with HIV, and especially in Africa and my country, Kenya. My diagnosis with HIV was in 1990, and this was a really dark day for me. The subsequent stigma that comes with it, and more so self-stigma because you have not even told anybody about it. It is a shock to you at the same time, and also external stigma from other people. How will you talk to your family? How will you tell people that you're HIV positive when you didn't even think that this is you? The assumption is that HIV is for those people who, have not gone to school, people do not have information, but here I was. So definitely I was in self-denial. In my opinion, the major barriers in resource constant regions, especially in Kenya, I see the poverty. For people to have their medication, they must take food. They must have resources. They must have, for instance, transport to go to the facility where you get your medication. You cannot do this if you do not have money. The other one is, for a long time, people have depended on taking medication because when we were diagnosed, we knew that we were going to die. We lived every day. But now that there are drugs available, there is that lack of, social support especially for the aging. Because when we were diagnosed those days, we had support groups for younger people, and we could discuss our issues with those support groups. But currently, because we are aging with HIV, we did not know that we would reach this age. So there is lack of social support for older people living with HIV. Of course, there is also stigma associated with older people living with HIV. So the assumption is that probably you have just gotten the disease when you're already late, not considering that you could have gotten the disease earlier on, and thus there is the stigma that comes with that. The challenges, some of the challenges that come with the intersection of HIV care and aging, especially in Kenya, include things like age-friendly care, especially at the health facility. There are no tailor-made specific treatment for older people living with HIV. You go to the same facility as young people who are HIV positive, and therefore sometimes it makes it very difficult for an elderly person, especially a woman, going to clinic and meeting with your daughter on the same queue. So those are some of the challenges that we face at the facility. There is also lack of treatment for noncommunicable diseases. When in our clinic, especially in Kenya, you only go for what treatment that you get is for ARVs. But then if you have other diseases, you are given a prescription or referred to a different clinic to go and see a different doctor, meaning that at that particular clinic, you will not be able to get treatment if you do not have money. So those are some of the challenges. Then many times we have diagnostic and treatment challenges. You are out of, like, for instance, you cannot be able to test your viral load or CD4 count. For instance, last year, I remember I did my viral load last year in February, and by this year, and that was 2021, and by this year in April, I had not received any test result. And this is also for many other patients who go to the clinic because of lack of commodities at the facility. And of course, also diagnostics of the same. Then we also see that there is specifically no home-based care for, older people living with HIV. You are actually on your own. When you're HIV positive and you're older, you are on your own. I think the other challenge that we see is on economic support. In a Kenyan setting, we do not have, for instance, homes for old people. So if you are an elderly person living with HIV of overage, and you go back to the village, because once you have retired, if you are working, for instance, you have gone back to the village, and you are actually on your own. You cannot fend for yourself, especially in terms of healthcare, because for healthcare you must pay for the same, and it is not very cheap. So you need money to do that, and you can only get money if you have an income. So there is need for some social income of contributions for elderly people living with HIV, so that they can be able to take care of their health. In Kenya, in terms of different cultures, I think people living with HIV are still behind, because, as I mentioned earlier, we were not prepared. And then we have also cultures that stop us from doing what we need to do as people living with HIV. As an older woman living with HIV, I cannot talk about sexual reproductive health rights, and especially the clinician also might be somebody who is young, and they will be wondering, and this old woman, she's already HIV positive, she's sexually active, she has presented with an STI, you're already HIV positive, and you are over 50. You are not supposed to be engaging in sex. So for you to present with a sexually transmitted infection in the facility, I mean, you are stigmatized. The physician might be a young person, and you are an elderly woman here living with HIV. You do not know how to even explain to them, and they also feel shy. So there might be wrong diagnosis, especially if you are not able to interact and say exactly what the problem is. So the doctor will actually be left to assume, because you're not able to open up as an older person. And, there is that shyness and a taboo actually to talk to your younger person on issues of sexual health, of or your sexual rights. So those are some of the issues that are overlooked. They are not discussed at this facility. I think even the younger doctor gets shy to even talk about it. And as a woman living with HIV, you also cannot relate to that young person who is going to ask you issues on your sexual reproductive health. Then the use of condom is also a challenge, because condoms are not affordable. So ideally, you will be looking for a condom at the health facility, which is sometimes free when condoms are there. It's not that they are always there, but sometimes you can miss those condoms, but you will not be free enough to open up and ask the healthcare provider to give you condoms to use. Of course, for men, sometimes it's easy. They can go to the shop and buy. Some of the factors to consider in resource-constrained settings for older people living with HIV to sustain livelihood is actually to ensure that there is that financial assistance, and also this can be done through programs that include income-generating activities, probably to have kitchen gardens or things like that. And then also lack of insurance. I had mentioned that early. At a certain age, after 50, 55, the insurance companies consider you as high risk. So they do not actually insure people who are above 55 years of age. And at the same time, the insurance, the hospital will require money when you are going for treatment. So to be able to go to the facility or to hospital, you must have some income with you if you don't have an insurance so that you can be taken care of. The other thing that we don't have, I had mentioned earlier that we don't have homes for older people living with HIV, which parents are left at home alone, and children are in the cities. That is the cultural way of how we live in Kenya and probably other African countries. The burden is left on the woman to ensure that there is food on the table, that you have money to do everything that is required. So everything is left on you. And as a woman, you might be going to, even fend the garden for other people, plantation. You work there and you are paid. So you even forget about yourself as a woman. You think about yourself last. You are HIV positive, you are old, you are tired, but then all these things you have to do as a woman living with HIV. Of course, even other women who are not HIV positive do that, but the burden here is that already you are HIV positive. You need care yourself, and then yet you're the one who is taking care of the other people. And sometimes you even have grandchildren who have been brought to you at home. Probably the parents died of HIV. So you're the same woman who is going to make sure that all these people get food, get clothing, they have to go to school. Some of the solutions that can be considered to reduce the barriers that I have talked about include coming up with policies for older people with HIV that can actually support the interventions that they want to carry out, and more so, probably to prioritize to reduce stigma and address sexual health for women living with HIV, which needs to be in the policy and also has to be implemented. Then also provide a comprehensive health public response to encourage good health and wellness. And probably we could be looking at a wellness center, we could be looking at support group, we could be looking for, generally activities that women living with HIV can come together and advocate even as they are, because as it says, nothing for us without us. So it is really for the women to be empowered to be able to, women living with HIV, older women living with HIV, to be empowered to be able to have a voice. I think it is also important to have promotion of policy to ensure rights of older people living with HIV and include a budget line, because we can have very good policies in place, but if there is no budget line, then it is not possible to have them implemented. And then we are also looking at age-friendly prevention. Probably that includes include maybe facilitators who are people who are older and have information on what is expected for them, especially when they come to deal with older women living with HIV and, of course, general population of people living with HIV who are elderly. Then we have to look for also better ways of diagnosis and treatment, and probably think of situations where we can have home-based care, people who have been trained on home-based care to also, I think this works really very well, especially like when we work with community health volunteers. So if we have home-based care services, then I think it will be more receptive to the older people when somebody who is friendlier, who is of their age mates comes and talk to them at where they are. Even when they are in the garden and, they come and talk to them for a few hours, I think that is something that would be appropriate. Then I think also I had talked earlier about the economic and social contributions. This is something that is very, very important, very, very important. And I want to underline that it is important to support these older people living with HIV to be able to be economically sound. I think in resource-constrained settings, and more so where I come from in Kenya specifically, we have quite a number of issues that we are grappling with as women living with HIV. Yeah, I think we need to go back to the drawing board and ensure that we have activities that are user-friendly to older people living with HIV. And this can only be done with the support of people living with HIV themselves, of course, with the support of other development partners and friends to ensure that this happens. It is very important that this happens. Thank you very much for listening.
Thank you very much to Dorothy Onyango, and thank you to our listeners for joining in. As a reminder, to view the full Conversations on Healthy Aging with HIV program on the Clinical Care Options website, click on the link in the show notes for this episode. And please be sure to check back for more episodes on important infectious disease topics. Thank you.